Hello everybody. Hi, I'm Dr. Jagannath Pal. Today is my first lecture and I have decided to discuss regarding one most common topic, that is the ABG. Today I will discuss regarding the ABG interpretation. I am not going to the details regarding the ABG. I am just only giving some tricks to how to interpret the ABG. So let's start. Now first I have to note down this ABG. To interpret this ABG, we have to know the major criteria of the ABG. The first is the pH. The second one is the PCO2. Third one is the bicarbonate level. To know the interpretation, first we have to memorize the normal value of all these three parameters. The normal value of this pH is 7.35 to 7.45. And regarding the PCO2, the normal value is very easy to remember, that is the 35 to 45. And the last, the bicarbonate level, the normal value of bicarbonate level is 22 to 26. So the first line is the whether it is ABG, whether it is acidosis or the alkalosis. If the pH, first we have to note the pH. If the pH is less than 7.35, it is acidosis. And if it is more than 7.45, it is alkalosis. So the first point is the acidosis or alkalosis. If it is less than 7.35, it is acidosis. If it is more than 7.45, it is alkalosis. Now the second point is that whether it is metabolic or the respiratory. The trick is that the CO2, PCO2 is maintained by the lungs. So the any abnormality in PCO2 is correspond to the respiratory parameter, respiratory part. Whereas the bicarbonate is maintained by the kidney. So any abnormalities in bicarbonate, it leads to the metabolic cause. So the first point is the acidosis, second point is or alkalosis, and the second point is the whether it is metabolic or respiratory. Next come whether it is compensated or not. Let's start with some example. First example is the pH is 7.25. CO2 is 50 and the bicarbonate level is 24. So the pH is less than 7.35, so it is acidosis. Bicarbonate is more than, there is change in the PCO2 level, whereas the bicarbonate level is normal. So if there is change in the PCO2 level, it is main part is the respiratory. So it is respiratory acidosis, as the bicarbonate level is normal. If the scenario changes, and I am giving a different example. If the pH is 7.56, PCO2 is 28, and the bicarbonate is 22. Again, there is a change in the pH level, as it is more than 7.45, so it is alkalosis. There is a change in the PCO2 level. The normal value is the 35 to 45, so there is less of PCO2. Bicarbonate is 20 to 26. This changes in the PCO2. The bicarbonate is normal, and the change is here. So it is respiratory. Again, it is a respiratory alkalosis. I am giving another example. The pH is 7.25. The PCO2 is 37. The bicarbonate level is 21. So the change is the pH level. So it is as because below 7.35, so it is acidosis. The PCO2 is 35 to 45, so it is normal in range. The bicarbonate level is 22 to 26, so it is decreased. So there is a change in the bicarbonate level, so it is metabolic. So it is metabolic acidosis. And I am giving another example. 7.56 pH, PCO2 is 40 and the bicarbonate level is 35. So there is a change in the PCO2 pH level. As it is more than, so it is alkalosis. Alkalosis. The bicarbonate level is 35 to 45, so it is normal in range. The bicarbonate level 20 to 26, so there is a change. So as it is changed, it is a metabolic. So it is a metabolic alkalosis. Very easy to interpret this type of ABG. Now we come another points, that is whether there is any compensation or not. Compensation. That means in this respiratory acidosis or alkalosis. Respiratory means that changes in the PCO2. More the PCO2, more the acidosis. Less the PCO2, it is alkalosis. So as there is a respiratory part is the PCO2 is respiratory, it will be compensated by the metabolic cause. That means there will be change in the bicarbonate level. If the changes is so many, if the changes is in the bicarbonate, that goes the pH level is normal, that will be the compensated, fully compensated. If the pH is not normal, that will be the partial compensation. Now I am giving some example that will clear your idea. First, you have to take pH, PCO2 level and the bicarbonate. The pH is 7.30, PCO2 is 50 and the bicarbonate level is 49. So there is a pH 7.30. As earlier told that as the pH is below 7.35, so it is acidosis. There is a change in the PCO2, also there is a change in the bicarbonate level. As it is acidosis and the PCO2 is higher range than the normal, so more the PCO2, more the acidosis. So there is a primary part is the respiratory. So it is respiratory acidosis. But here is the bicarbonate level is also changes. More the bicarbonate, more the alkalosis. So to compensate this acidosis, the body has produced more bicarbonate level. So there is a more increase in the bicarbonate level. So it is respiratory acidosis with compensation. How much compensation? As the pH is not goes to the normal value, so it is partial compensation. If it is goes to the normal value, then it will be the full compensation. I am giving another example. pH is 7.50, PCO2 thing about 51 and the PCO2 is 41. So the change is the pH level. So it is alkalosis. There is also change in the PCO2, also change in the bicarbonate level. More the PCO2 will be the more acidosis. So not is the here is not the acidosis, so it is alkalosis. So, and more the carbon dioxide bicarbonate level, more the alkalosis. So the primary cause lies here. So it is metabolic alkalosis, and as there is also change the PCO2 is also compensation. How much it is compensation? As the pH is not comes to the normal, it is partial compensation. So metabolic alkalosis with partial compensation. I think it will be clear to you. Now giving another example of a full compensation. Here is the 7.35. PCO2 is 49 and the pH is 30. The bicarbonate level is 30. The pH is the 7.35. So it is normal. Bicarbonate is 49, 35 to 45. So it has increased. More the bicarbonate, more the acidosis, and the PCO. But the bicarbonate level is 30. So it has also increased. Here the part is that I have a tricks that if the pH I have to the normal value of pH is 7.35 to 7.45. If I range is 7.35, 7.36, 7.37, 7.38, 7.39, 7.4, and again 7.41, 7.42, 7.43, 7.44, and 7.5. Though it is in the normal range, but it comes to the more acidosis part. But normal acidosis part. And in the second half of the pH normal value, it's more on the alkalosis part. Normal alkalosis part. So as the pH is 7.35, it is more closer to the acidosis. So though the pH is normal, but we have to consider that if the pH is less than 7.4 to 7.35, so it is acidosis. As because I had told that more the carbon dioxide, more the carbon dioxide, more the acidosis. So the primary part lies on the respiratory acidosis. To compensate this acidosis, body has produced more bicarbonate level. That means to compensate acidosis, body has produced more alkali. But as the pH comes to the normal, so there is a compensation, but it is fully compensated with full compensation. Let's see another example. .45, 44 and 48, and also the bicarbonate is 35. So the pH is, though it is in the normal range, so pH is more than on alkalosis part. So this is alkalosis. And there is a PCO2 is increased, and also there is an increase in the bicarbonate. As the bicarbonate is increased, so the body will be more alkalosis, so the primary part lies here. It is a metabolic alkalosis. To compensate this metabolic alkalosis, body has changes the PCO2 level to the more pH towards the more acidic, so it is compensated. As the pH comes to the normal, so it is fully compensated. So the interpretation will be metabolic alkalosis with full compensation. So this will be the in nutshell to describe how to interpret the ABG. Thank you.